Welcome students. Today in the series of anatomy of structures in the pelvis, we will study anatomy of rectum. As you can see, rectum is the lower part of hind gut. Gut, as you know, is divided into three parts: foregut, midgut and hindgut. So the hindgut, lower part of the hindgut is called rectum. Extent क्या है rectum की? From where it starts and where it ends? It starts at the end of sigmoid colon and it ends at the beginning of anal canal. But in anatomy, we should have some specific landmarks. And what are those specific landmarks? It begins at the level of S3. That means the third sacral vertebrae. See, this is S1, this is S2, S3, S4, S5 and this is cos6. Okay? So it begins at the level of S3 vertebrae, exactly at the same point, and it ends little 2 to 3 centimeter below the end of cos6 and also 2 to 3 centimeter in front of cos6. So this is the point, 2 to 3 centimeter below and in front of end of cos6. So this is the extent of rectum. This is clear. Now the length of rectum is 12 centimeter. Kitna length hai? 12 centimeter. And the width is, that means the diameter in the upper part is 4 centimeter, but in lower part we can see one dilatation in the lower part and this is called rectal ampulla. Okay, so now this is the rectal ampulla. So you know about the extent, you know about the dimensions of rectum. Now relations. First of all, if we just talk about the anterior surface of rectum, this is it. We will divide it into three parts: 1, 2, 3. Means upper 1/3, middle 1/3, lower 1/3 of rectum. In males, only the upper 1/3 is covered by the peritoneum. See, this white line is the peritoneum, peritoneal fold covering the superior surface of urinary bladder. Then it is reflected back on the anterior surface of rectum and continues upwards along the sigmoid colon. And this is called rectovesical pouch. This is the rectovesical pouch. The pouch of peritoneum formed between rectum and urinary bladder. Clear? Now, in the upper 1/3 of rectum, this peritoneal fold is covering the anterior surface as well as the lateral surface of rectum. But in the middle 1/3, only the anterior surface is covered. Here it is not coming here because loop of intestines are absent, because intestines, they are always having peristaltic movement. So the picture, whenever we take it, they are going to vary. So it is a potential space, this rectovesical pouch. Depending on what is coming when, we will have its length, but it will not go any further. It will just go up to the end of the middle 1/3. So the middle 1/3 of rectum is covered by this peritoneal fold only in its anterior portion. That means the anterior wall. But the lower 1/3, see this portion, it is not covered by peritoneum. Okay, so the lower 1/3, upper 1/3 of rectum, I again repeat, upper 1/3 of rectum is covered anteriorly and on the sides by the peritoneal fold. Clear? In the middle 1/3, only the anterior surface is covered, but in the lower portion, no peritoneal fold is present. Clear? Now the relations. The upper 1/3 is related to this rectovesical pouch. Clear? That is there. And in the rectovesical pouch, there will be folds of sigmoid colon, there will be folds of intestine. So these are the anterior relations of upper 1/3 of rectum. Middle 1/3 of rectum, it is related to only again the pouch, rectovesical pouch, and this posterior surface of urinary bladder. But in females, the relation is going to be different, because in females, between the urinary bladder and rectum is present the female reproductive organs. That means we have got uterus, we have uterus which ends in cervix, but cervix is lying inside the vault of vagina. So what we will find that the upper 1/3 of rectum in females is also related to the same thing. That means the pouch, but there the pouch is called pouch of Douglas or rectal pouch. Now it also contains sigmoid colon and loops of intestine. There we are same, but the middle 1/3. In middle 1/3, relation is different, because in middle 1/3, anterior to the rectum is the posterior surface and the lower part of uterus, and the upper part of posterior surface of vagina, also called posterior fornix of vagina. Lower 1/3 of the rectum in males is related to, you can see here, seminal vesicles, prostate gland, then the ureter will be coming, then ductus deferens duct or vas deferens, which will enter this prostate gland, and when this duct of seminal vesicle will join it, it will be called ejaculatory duct. So ductus deferens is also related to it. So seminal vesicles, prostate gland, ductus deferens, ureter, then urethra, they are all related to the lower 1/3 of rectum anteriorly in males. But in females, the lower 1/3 is related to only the lower part of vagina. Clear? Posterior surface. Okay. Now, this was the relation, anterior relation. Posteriorly क्या present है? You can see very clearly, posteriorly it is related to sacrum, coccyx. And you can see this intervening fat, you can see the ligaments here. And apart from this, the muscles which are forming the pelvic floor, they are also having attachment to these bones. So piriformis, coccygeus, these muscles are also present posteriorly. So this was the posterior relation of rectum. Now, if we see inside the rectum, what we find? We find that the mucosa is having folds, transverse folds. There are 3: upper, lower and middle transverse fold. That means folds coming like this, like this, like this. The one is upper, one is middle, the other one is lower. So 3 mucosal folds which are transverse in nature are present inside the rectal cavity when it is empty. Now, if you see about the blood supply of rectum, it is supplied by rectum, artery is supplied by median sacral artery, because it is related to the sacrum. Median यानी एक मिडिल में है, जो बिल्कुल मिड लाइन में बॉडी के, median sacral artery, then upper rectal artery, middle rectal artery. These are the arteries which are supplying it, and the veins draining are also the same. That means median sacral vein, middle rectal vein, upper rectal vein. The lymphatic drainage. Lymphatic drainage is a little different. See, as I have said, gut is divided into 3 parts: foregut, midgut, hindgut. Clear? Artery of foregut is principal artery, celiac trunk. Midgut principal artery is superior mesenteric artery. So the midgut is going to be drained by the vein of the same name, superior mesenteric vein. The hindgut has a principal artery, inferior mesenteric artery, and it will be drained by inferior mesenteric vein. So, the lymph nodes which are related to celiac trunk are called celiac lymph nodes. The lymph nodes related to superior mesenteric artery are called superior mesenteric lymph nodes. The lymph nodes of hindgut which are related to the inferior mesenteric artery are called inferior mesenteric lymph nodes. Clear? So the upper part of rectum will drain along with the inferior mesenteric lymphatics, and they will drain into the inferior mesenteric lymph node. Inferior mesenteric lymph node, because inferior mesenteric artery is the principal artery of hindgut. But the lower part of rectum, the lower part of the rectum, it is drained by the lymphatics which go to the lymph nodes of internal iliac region, that means related to internal iliac artery. So the lymph nodes of internal iliac artery, so we call it internal iliac lymph nodes. The upper part is drained by the lymphatics which are going to the inferior mesenteric lymph nodes. The lower part is drained by the lymphatics which are going to internal iliac lymph nodes. Clear? So nerve supply, we are left with nerve supply. Both parasympathetic and sympathetic nerves are supplying it. Now, if we talk about its ligaments, the main ligament, the supports, we can say supports of rectum. Ligaments are there. Most of the ligaments are nothing but condensed fascia. The condensed fascia, condensed peritoneal folds, they are not going to give big support. But yes, because they are connecting, we do call them as accessory support. So the main support of rectum is same as that of other pelvic organs. That means the pelvic diaphragm. The muscles which form the pelvic diaphragm are the main muscles, means levator ani and perineal body. Where is perineal body present? Somewhere here, means in front of anus and behind the urethra in males, but in females it is going to be between the posterior wall of vagina and anterior wall of anus. There is the perineal body. So all the muscles of the floor of pelvis forming the pelvic diaphragm, main is levator ani, and because all are condensing into one portion which is the perineal body, so perineal body is a very important structure there. This is giving the main support to rectum also. Next, you can say lateral rectal ligament, means the fascia, pelvic fascia which has condensed on the lateral side. Then there is going to be a posterior also and an anterior portion also. The fascia present anteriorly and condensed, and the fascia present posteriorly and condensed. Anteriorly between the bladder and rectum, the fascia which has condensed and so it is giving a little bit of support is called fascia of Dennen-Willer. D comes before, isn't it? And the posterior is behind, means afterwards. So that is fascia of Waldeyer. So fascia of Dennen-Willer is present anteriorly, fascia of Waldeyer is present posteriorly between the bones sacrum and coccyx and posterior wall of rectum. So these were the main supports of the rectum. Now the applied anatomy of rectum.